What's up everybody, Neil here, and it's time to introduce to you my 4-part series about shoulder health. This 4-part series can be completed in parts or in full to assist in your post-physical therapy rehab strength and conditioning, your in-season strength and conditioning, or regular out-of-season or general shoulder health rehab and upkeep. First part of this series that we're going to talk about is soft tissue. The second part is going to be distraction work. The third is going to be activation. And then last, we're going to go over strengthening of the shoulder joint and the surrounding muscles. Welcome to the soft tissue portion or myofascial release portion of this shoulder rehab and health workout. Now remember, just a couple things about myofascial release before we get started. Our fascia runs through, around, in and out of all of the tissues in our body. It runs around and through our organs, around and in between our muscles. And it's one of the most important things that we have in our body that some people neglect. Now, there's multiple ways to do this type of release. And if you look back on my website, there's going to be other posts about myofascial release in greater depth, and you can go back and refer to that. But what we're going to do today is we're going to go over the first 3 spots on our shoulder health day. So we're going to go through the chest, the trap, and the upper back, between the shoulder blade and the spine. The first one that we're going to do is the chest. You're going to grab your myofascial release tool. I'm going to pick my AccuMobility ball for today, and what we're going to do is we're going to search for a knot or adhesion in the fascia and the muscle. Now, we're going to search for about a 6 out of 10 on the pain scale, because any more than that, the muscles are going to tense up and try to fight whatever work or whatever release you're trying to do at that time. Second, we're going to hold this for 2 minutes at a time. We're going to make sure that whatever tissue, if it be superficial or deep tissue, that we're going to get into it, and the reason we do that is to release all of that tissue and make sure that we don't miss a thing and we don't miss any release or ability to gain a range of motion or lower that pain. So, as you go along, we're going to go with the chest first. We're going to find the pec major, or the larger portion of the chest here. I'm a great believer that the pec major is the driving force that rolls that shoulder in and causes a lot of that impingement in the front of the shoulder there. So we're going to find that spot. Remember, a 6 out of 10 on the pain scale. I'll do this side instead. And we're going to, once you find that spot, you're going to lean on in and you're going to work for 2 minutes at just holding that ball in place. Now, once you've set your clock for that 2 minutes, that 2 minutes is up, you're now going to go to the other side. Regardless of which shoulder is damaged, you're going to do both sides to make sure that our entire upper body is good to go. The next spot that we're going to get is the trap. So what you're going to do, instead of finding that spot beforehand, we're going to find that spot while we lean up against that post. So what we're going to do is we're going to get that ball, or that AccuMobility ball in this case, into that post. Now I found a spot right away. So what I'm going to do, if I have my clock on, I'd set that clock for 2 minutes and try to just rest. Now the pain may be pretty real, but once you find that 6 out of 10 pain area, you just got to hold it, and I promise that you're going to have a nice deep release into that fascia and soft tissue. Now again, once that 2 minutes is up, you're going to switch over to the other side. Next, we're going to go over the upper portion of the back, between the shoulder blade and the spine. Now there's a lot of muscles in there. You have your lower trap, your rhomboids, and a lot of other connections for your smaller but important intrinsic muscles that line the spine. But like I said, this time we're going to get the ball on there first. Then you're going to position yourself where that ball or soft tissue tool is in between the shoulder blade and the spine. Now again, you're going to find a spot rather quickly, and once you do, let's do our best to protract the shoulder and the scapula, bring that arm and shoulder away from the body to open up that area between the spine and the shoulder blade a little bit more, and you'll definitely feel this one. And again, you may need to pause the video, but we're going to hold that for 2 minutes. After that 2 minutes is up, you're going to go over onto the other side. And that is the first part of our soft tissue or myofascial release work. Up next, we're going to have the rotator cuff muscles to make sure that not just the area around the shoulder, but our internal, external rotators of that shoulder are released and ready to develop a new movement pattern. This next portion of the soft tissue work for our shoulder health day, you're going to need 2 tools. You're going to need your myofascial release tool, which in this case I'm going to pick the Active Mobility Ball once again, and then you're going to need what looks like one of the body bars that you can find in the gym. Any sort of shaft that has a rounded edge that you can get into a hard to reach spot. So we're going to have 3 spots here. The first one is going to be the infraspinatus, which is one of our big rotator cuff muscles you're going to find right on the back of your shoulder blade, right beneath the spine of your scapula. So you're going to find this bony area right here, and then you're going to find the area just beneath it. This is going to be the same or similar to the other portions of the soft tissue. So I found a spot immediately. So once you find that spot, you only want to get like a 5 or 6 out of 10 again, because this is a much smaller area. The muscle is much smaller and will react with a little bit more intensity. So once you find that spot, again, right in the middle of the shoulder blade itself, you're going to hold that for 2 minutes. So go ahead and set your clock, and then you can pause the video and we'll start in just a moment. The next spot that we're going to get is going to be the teres major and minor, which we're going to come to what looks like our armpit right here. So find the shoulder blade, come into where the armpit and the tricep and lat are going to connect, and you're going to find that there's 2 little muscles right here. And those are going to be super important for us to get into. So we're going to find that spot, should be rather tender right away, and once we find that spot, we are just going to hold it for that 2 minutes. Now this entire area in there is going to be pretty sore, so make sure you set that clock for 2 minutes, find a spot that's a 5 or 6 out of 10, and just hold it. Now that we've gone through that part of our soft tissue work, we're going to have one last area of our shoulder, and it's actually going to be the subscapularis, which is the inside of our shoulder blade, and it's going to help with internal rotation of the shoulder. So we're going to find that weighted shaft or a stick mobility shaft or whatever it might be, a wooden dowel, and we are going to get the end of that onto the inside of our shoulder blade. So you're going to feel where your lat is, you're going to feel where the shoulder blade comes into play, and you are going to put this gently, because this is the inside of your shoulder blade. It's going to be a much more tender area, and we're going to shoot for a little bit less pain on this one. So a 3 or 4 out of 10 on that pain scale onto the inside of that shoulder blade, and you're going to hold it for 2 minutes once again. And once you hold that for 2 minutes, you can go ahead and move on to the next part of our shoulder healthcare day, which is going to be the distraction portion. So we're going to try to make a little bit more room in that shoulder joint to make sure that we can increase that range of motion for that workout session that we have coming. This next part of the shoulder healthcare day is going to be the distraction portion. So what do we mean by distraction? Distraction work is trying to get the actual joint itself to create a little bit of space in the joint so we can increase our range of motion and hopefully start to develop a new pattern. So we're literally trying to separate the joint just slightly. So for the first one, we're going to go from behind. So we're going to grab the band, connect it to our support beam or squat rack or whatever it is. Meanwhile, the band's going to be a moderate resistance. We're going to put it behind our shoulder. Make sure we're holding it in place just slightly. And then we're just going to go through a flexion and extension of that arm. We're not going to go through any hyper extension and flexion. So we're just going to go through this motion right here. We're going to go through about 1 minute on each side. And you can really start to feel that shoulder joint start to separate just a little bit. Make sure, as a rule of thumb, you take this with a little bit more caution than you would the other parts of this shoulder healthcare day, because if you have any sort of rotator cuff damage, we don't want to aggravate it. We just want to relieve a little bit of that tension. And now for the next part, I'll demonstrate on this side. Similar function here, so we're going to allow this band to pull on our shoulder, separating it from that joint just a little bit. And now we're going to bring our arm through a range of motion. Again, take this part lightly. We're just trying to create a little bit of space in that shoulder joint. Now, once we're done with our distraction portion, which was rather short, it will be beneficial. We're going to move on to the activation portion of our workout. Now it's time to move on to the activation portion of our shoulder healthcare day. And we're going to start with a couple basic exercises to start to loosen up and send some blood flow to this area. So hopefully we can start to rewire how our shoulder operates and how our nervous system feels about how our shoulder operates. So the first thing I'm going to do is we're going to have our hands straight out in front of us. We're going to have our thumbs up, fingers pointed forward, palms in. And we are going to retract and protract our shoulder blades. So don't worry about how coordinated this feels or how efficient you are at this. Just do your best to keep your head still above your spine, having your shoulders come back together and then away. Have them come back together and then away. We're going to do 10 reps of each one of these exercises. So the next exercise, we're going to go into a quadruped and do that same thing. So we're going to get down on all fours and go through that same motion one more time. But this time, we're going to have the weight of our body to retract and protract through that range of motion and through that shoulder. So like I said, we're going to come from here. We're going to have our shoulders directly over our hands about shoulder width apart, and we are going to retract down towards the ground and protract away. So let that body sink down towards the ground as those shoulder blades come back towards the spine, and then we will push them away. And as I said, we're going to get 10 reps of each one, and then we're going to move on to the next exercise. And the next exercise, the activation portion, is going to be a retract and protract using a resistance band. So you can grab any sort of resistance band. I recommend grabbing a light resistance. So this way, when we go to retract and protract, we are only warming up those muscles and activating those muscles. It's not too strenuous on that body. So I'll demonstrate from this angle here. So as you can see, I have my band connected to the pole of the squat rack, and I'm going to retract that shoulder blade all the way back towards my spine and then allow it to protract away from the body. So we retract and protract. Remember, 10 reps on each side for this portion right here. And if you need to, you can pause the video, go ahead and do both sides of the retractions. After that, you're going to grab that same resistance band, but we're going to go from in front, and we're going to allow that shoulder blade to retract with the resistance of the band, and then we're going to protract and push that band and that shoulder away from the body. So we're going to bring that in and then allow that shoulder to go away from the body with each rep. Now for this next portion of the activation of our shoulder healthcare day, we're going to get up against the wall and we're going to abduct our shoulder to about 90 degrees. And we're going to go through with a flat back. Okay, we want to keep our back flat against this wall so everything is operating from the shoulder. Because we're still going through the activation portion, this is going to be very light. We do not need to go to the end range of either internal or external rotation. So what we're going to do is we're going to get that upper back nice and flat, get this as close to 90 degrees as we can, and now we're going to go through a light internal and external rotation of the shoulder with no weight. And we are going to do 10 total reps in either direction on each side. And you may even begin to start increasing your range of motion here, but definitely don't force anything. We are still just beginning that portion right there. After that, we're going to go into what looks like a similar position, but we're going to have our shoulder and our tricep up against the wall. And this is called a sleeper stretch. Again, we're only trying to go for a slight warm-up here, so don't push this range of motion, but allow this arm to come in and out as we essentially floss the inside of that shoulder joint. For this next part of the activation portion of our shoulder healthcare day, we're going to go into Y wall slides. So we're going to have a stagnant stance to start. We're going to have either foot back. I like having my left foot forward here. And we're going to come into what looks like a resting plank position on the wall. But this time, you're going to press into the wall and try to get your body aligned with that wall as those arms go away, and we're going to start to increase that range of motion once again. So we're going to come from here, start out in what looks like that plank position, and we're going to extend as my body comes towards the wall and my arms go up. We're going to do 10 reps of this one as well. Next, we're going to have a very similar exercise to the wall Y slides. This time we're going to have Y slides. We're only going to elevate and depress those shoulder blades. So we're going to get into that top position to start. We're going to come from here, and now with our body fully extended, we're going to just sink our scapula down and then away from us. So we'll come down and away, doing our best to keep those elbows nice and straight and our arms pressed up against that wall. So again, we're going to have 10 reps of these as well. So next up, we're going to have a arm car or a wall-assisted arm circle to try to lighten up and loosen up the front of that shoulder. So what we're going to do is we're going to come onto one knee. Whichever side the wall is on, we're going to have that knee up. And we're going to come as close as we can to the wall with being able to stay upright and stable. And we're going to go through an entire range of motion from here. We're going to continue to go nice and light. You're going to feel a good stretch from the front of that shoulder and a little bit from that chest. A couple cues here is to keep the shoulders, torso, and hips all facing in the same direction, nice and straight if you can. This next part of our shoulder health care day, we're going to go over the strength portion, which we're going to touch upon the intrinsic, internal, external rotators of the shoulder, which are commonly referred to as our rotator cuff muscles. And then after, we're going to go over the extrinsic muscles, which are the ones that we see when we flex. They're our delts. First things first, we're going to go over external rotation at a 90-degree abducted position. You may need a box, which when we come to it, we're going to want to sit down and do this, or stand if you have a box high enough. What we're going to do is we're going to get tall through that torso. Belly button in, transverse abdominis engaged, because we want to make sure that we're rotating from the shoulder and we are not hyperextending from our lumbar or T-spine. So we're going to come to this position here. It may be easier to cross one leg under the other, and we're going to come into that 90-degree position with our arm flat on that box. Now, with a 5 to 10 pound cable or resistance band, we're going to grip firm, keep that arm perfect in line, elbow to shoulder, and then wrist to elbow. And we are going to externally rotate away from that wall. Now, two things that are important to notice here. I'm not stressing my end range of motion, and I'm not doing this too fast. We want to make sure we go through our natural range of motion here and hold it at the top for just a slight second. That's going to lead us into internal rotation of that shoulder. So we're going to go over to this side now. And we'll shift this just slightly so we can see. We're going to come into that position again, but this time we're going to have the band pulling from behind us. We're going to get our arm into that 90-degree abducted position. So we're going to start out in a 90-degree position with that arm, hand over elbow, elbow in line with the shoulder. Long spine, proud chest. We do not want to hyperextend in order to get that arm forward. And again, we're just going to come from here. We're going to have our starting position be 90 degrees, and we're going to come forward using our internal rotators of the rotator cuff. Again, we're not forcing any end range of motion here. We're just going through a natural range of motion, strengthening those internal rotators of that shoulder. That'll lead us into the next portion of the intrinsic muscle strength workouts here. So we're going to grab either a towel or a padded bar mat that you would see on one of the squat racks. But essentially, we just need a 2 to 3 inch space between the elbow and the rib cage, because we're going to practice external rotations with a 90-degree adducted position. That means the elbow is close to that rib cage. So again, find something that gives us 2 to 3 inches, and we're gonna let this band pull us all the way in, tall spine, engage your core, proud chest. Okay, so we're going from an internally rotated position to an externally rotated position. And again, we're not forcing any end range of motion here. We're just going through our natural range of motion, trying to strengthen those rotator cuff muscles and those external rotators. So after you finish your reps on this side, you can go ahead and go into internal rotation strengthening. So for demonstration purposes, I'm just going to switch arms and continue to face the camera. And what we're going to do is we're going to take another step out, have that arm get pulled into external rotation with the band or cable column, and then we're going to pull into internal rotation from that band. And again, we're not stressing any end range of motion here. Whatever natural range of motion that we've developed is what we're going to use, and we can work on extra end range mobility later on. Now it's time to move over to our extrinsic strength part of this shoulder healthcare day. So in a moment, we're going to go over some dumbbell movements to strengthen the outside part of that shoulder, which is going to be our delts. Now we've moved on to the extrinsic strengthening of that shoulder joint. We're going to go through lateral and front raises to strengthen those shoulders. But we're going to add a little bit of biorhythm into that to start connecting how our shoulders actually going to work when we are going through any sort of athletic or difficult activity. So for our front raises, we're going to have a reverse step and forward step with each raise. So as you can see, I'm not letting the dumbbell swing too much, but a little momentum is okay. So the body absorbs, redirects energy. But what we're going to do is we're going to start with our right foot forward if we're going to have the dumbbell in our right hand. And when we step back with the right, we're going to raise with the right. And you can allow, if this is a cup of water, you're going to allow a little bit of that water to pour out to the center line of your body as we come up. So as I said, we're going to start with that right foot forward, and we're going to step back with the right and raise with the right, just as our gait pattern would appear. Now, try not to swing too much. We are using light weight here, depending on the severity of your shoulder injury or the stage of your rehab. This may be as little as 5 pounds or as much as 15 or 20 pounds. Now for the same type of concept for the lateral raises. But what we're going to do is we're going to come across the body and step out with that dumbbell. This time, as we come across the body, the dumbbell will come across this front leg. So as the right arm comes in front, the right leg will go behind. I'll demonstrate from behind and in front to give you a little bit more info on how it's going to work. So as that dumbbell comes in front, that right leg goes behind. As that dumbbell comes to the side, that right leg is going to come to the side as well. And now for that front view. Now again, we don't want to swing too much, but we want to keep a little bit of rhythm here so we have a little bit more natural use of that shoulder joint. Next up, we're going to talk about another biorhythm-based shoulder exercise to finish up this entire shoulder healthcare day. Now for this last exercise of the shoulder healthcare day, it's going to wrap up everything together. So this is going to strengthen our rear delt, and we're going to do it with a biorhythm type cadence. So what we're going to do is we're going to start with that left foot forward this time, and the right arm straight ahead of us. So when we step back with the left, we will step back with the right. So as shown, we're going to have that left foot forward, and we're going to match the right shoulder to the left glute. So we're going to try to pull with as straight of an arm as we can, just leaving a little bit of bicep engagement in there so we keep a nice, tense, safe contraction of that entire arm. So we're going to step back and fly in rhythm, making sure that the body rotates properly and keeps a good, tense feeling in that shoulder. And this should take care of our rear delt and some of those extrinsic muscles of the shoulder and upper back. Now that concludes our shoulder healthcare workout. Thanks for watching, and I'll see you next time.